What is sleep apnea?
It is one of the forms of sleep disorder breathing where the airway collapses and no air is able to pass the obstruction that's created when the airway collapses when a person sleeps.
What causes sleep apnea?
What causes an airway to collapse is that as you get into deeper stages of sleep, you lose the muscle tone that supports the airway. So in deeper stages of sleep, our large muscles become paralyzed, and we lose that reflexability to maintain the airway. So for certain people, certain individuals, that airway collapse causes an obstruction in the airway.
Who is at risk?
The chances of you developing sleep apnea are greater as you get older. Women are less likely to have sleep apnea than men until they reach the age of menopause. Once they cross over the age of menopause, their chances of having sleep apnea are pretty close to males.
What are the symptoms?
What a lot of people experience is excessive daytime sleepiness, cognitive impairment. It puts patients at a much higher risk for cardiovascular events like cardiac arrest, sudden heart attack, puts them at a higher risk for stroke.
If I snore, does that mean I have sleep apnea?
Snoring is not natural. That's not a normal occurrence. You shouldn't, if you snore, that means that something is going on with your airway to kind of restrict the airflow. So not everybody that snores has sleep apnea, but if a person snores and then they're observed to kind of gasp for breath or catch their breath at night, or if a bed partner witnesses them, ceasing breathing for a while or struggling to breathe, that's a pretty good indication that we've moved from snoring to some type of upper airway resistance, maybe even into sleep apnea.
What treatments are available?
The kind of gold standard treatment for sleep apnea is continuous positive airway pressure, or CPAP. CPAP is the most common form of treatment for sleep apnea, where again they're using room air under pressure to kind of blow past that obstruction. So when I talk with my patients, I talk about it's like blowing up a deflated balloon. So when the airway collapses, blowing that air through there elevates and opens up the airway to maintain an open airway. The second most common treatment for sleep apnea is oral appliance therapy. They're kind of like a football mouth guard size type of appliance. And what we're attempting to do is when a patient sleeps and the airway collapses, the lower jaw, this being the lower jaw, tends to drop back. And everything that's attached to the lower jaw, the tongue is attached to the lower jaw, the tissues, of the throat are attached to the lower jaw. When that drops back, that's where the obstruction occurs. So what we attempt to do with oral appliances is bring the lower jaw forward a little bit, but it's primarily about stabilizing the lower jaw and not allowing it to drop back. So when we put the appliance in place, we have some mechanism that doesn't allow it to get back past the point where we initiate the treatment. So any appliance that we have that allows us to stabilize that lower jaw is how we maintain the airway. So rather than blowing air to open up the airway with oral appliances, we're trying to prevent the collapse of the airway to begin with. There are some surgeries that are performed. Surgeries are less effective for most patients.
For more information about sleep apnea, go to the website of the American Sleep Apnea Association.